Well, a very good evening to you, Desiree. Subsequent to the announcement by the Health Minister today that the numbers have risen to 7 in terms of the cases that have been confirmed of the coronavirus, a number of stakeholders within government are having separate meetings on the side, but all together, of course, culminating with the Department of Health on what South Africa's way forward should be. And you would know that tourism being one of the biggest sectors which is expected to be hit quite hard as a result of the coronavirus. The Minister has been having a stakeholder meeting since early this afternoon, and she's just concluded that and basically allaying the fears of South Africans, allaying the fears of those in the tourism sector that even though that at this point the tourism sector is expected to be hit quite hard, South Africa is looking at all plans at this stage to ensure that its citizens remain safe at this point. Let the Minister join me now. She has to leave. Minister, thanks indeed for your time this evening. You had an engagement with the sector, the tourism sector, from this afternoon. What exactly came out of that? Are they satisfied with what South Africa is doing currently to contain the coronavirus?
I think the sector mainly here, we were looking at how do we respond collectively, how to put our heads together and work together. And what we have agreed is that mainly as South Africa, we normally come out very stronger if we stand together. We've learned with many areas. And one of the things they're saying that we need to communicate more. We've been able to survive quite a lot of things and we've come out very stronger. And that's the message firstly. Secondly was to evaluate where we are in terms of either whether it's cancellation from activities related to tourism, how do we have a response? And we were looking at various scenarios, as I said earlier on. There are 3 scenarios that we had to look at to say the first scenario, if we are not going to have more infections, and therefore how do we respond, we can be able to recover. But we are testing certain ideas with them to say, what is it that you think we should be able to do? So it was quite informative because we had people whose businesses operate not only in South Africa, but globally. So they were able to tell us what has been the trend in other countries, what is it that are lessons that we can learn, we shouldn't do, what others have done. So the issues around, we looked at the issues around the travel bans, are they advising or not? The issues around whether we should limit the conferences or big events, whether we should also even our own tourism Indaba, whether we should move it or not. So those were the feedback. So we'll process that as government, the feedback. Obviously, they will, if there are still questions that we need to get, we'll get them, then take the report back to the IMC, which is chaired by Minister Mkize, so that we can say this is what came out of the sector of tourism and the impact. We can't lie when we say it's not going to be impacted upon. It's going to be impacted upon negatively. There is a threat for jobs. And you know, tourism is one of the labor-intense sectors. So part of what we are looking at is to say, are there things that we can do upfront to prevent and save businesses, and those are the things that we have to look at. There are areas that they highlighted, Zelda. The issues around them being able to unable to pay their loans, them being able to keep the staff, whether there will be support from Department of Labor in terms of business that are in distress. So those are some of the things, incentives, other way even raising to say, no, are you able to try and limit even on the restrictions of regulation? So that will not be able to decide as tourism, but we can take back to broader government to say, these areas, for example, in transport, this is what the industry, the airline industry, which is carrying the people, are here saying the people who are in the rental, the car rentals, who are reporting to say actually the rental accommodation is expensive, we are likely not to be able to do it. So those are some of the feedback that we are getting, and we are able to look at it broadly, and we'll carry the message to broader community meeting, to broader meeting of the IMC.
All right. Minister, what would warrant, stopping tourists from coming into South Africa? I mean, we're on 7 cases at the moment. I know that the Minister of Health had indicated that a cabinet meeting would be held to decide what South Africa's stance is going forward. But from a tourism perspective, what would the situation to you be? What would the dire situation be for you?
Look, from our side, we're looking at globally what WHO is advising. WHO together with UNWTO have advised to say don't isolate countries. So there's that message. But learn to be able to manage it in terms of either the people when they come, whether you restrict their movement, you manage them, you trace them where they are, instead of banning. So we look at other countries that have issued bans, what is it that they have done, and what are the measures. So those will have to be linked, because we are not health experts. We are not epidemiologists who know how the epidemiology moves or the virus will move. So our issue is to say, what is the information from our side that we can provide, and then collectively we can take a decision. So we are not yet there in the decision making, but we'll input towards that decision. And I don't want to, because I want to act within the confines of cabinet. I don't want to be preemptive of what cabinet will say, because tomorrow we'll say, no, Minister of Tourism didn't support this, so it means it happened outside the support. I don't want to do that. But what we do, we gather information so that it assists, so that government, when it takes a decision, it takes it from an informed point of view and has looked at all the pointers.
Right, Minister, I know that you really have to leave. Thank you very much for speaking to us this evening. I know you have another scheduled interview, the Minister of Tourism. Quite an important engagement, I think, that was taking place here in Sandton this evening. Obviously, the tourism sector, Desiree, expected to be hard hit by the spread of the coronavirus. South Africa standing on 7 cases, confirmed cases at the moment. And what's important to know, perhaps what we'd need to see over the next couple of days, Cabinet would need to decide, also according to the Health Minister, when we spoke to him a bit earlier on, Cabinet will need to decide on whether there will be travel restrictions going forward on the basis of how much further the coronavirus does impact on South Africa. So Cabinet would need to make that decision. The Minister also saying that she'll wait for that decision from Cabinet. They will take this input that they had here with the tourism stakeholders. Some concerns being raised about possible job losses in future if this continues. Also issues of whether they'll be able to pay their staff, and exactly what impact this will have in terms of specifically tourists that will be coming from those particular areas where there are high numbers of confirmed cases and deaths that are reported as well. Desiree.
Thanks a lot there, Griselda. I suppose it is all hands on deck, that conversation with the tourism minister, who's just had a multi-stakeholder conversation. Let's now welcome our guest, Zipporah Maisela. She's the mother of a child who's working in China. We'll also be joined later on by Dr. Martin Chalano, who's a doctor based in China. He'll be joining us on Skype. Later on the show, we'll also be joined by Giwizi Lubilo. She's a teacher based in South Korea. The numbers really growing at a staggering pace there. And also we'll be joined by Dr. Anban Pile from the Department of Health. He'll also be joining the conversation. He's the Deputy Director for General Health Regulation and Compliance at the department. We have invited the National Institute of Communicable Diseases. They informed us that they were unable to participate as they do not have an expert available. Zipporah, let's welcome you to the show. You are the face of that South African who's really worried on this day about, we're worried about contracting the disease here, but you have a child in China. How have the past few weeks been for you?
Thank you, Desiree,